Recently, many of us were saddened by the death of superstar Whitney Houston. Her untimely passing sent shockwaves across the globe. Given her history, the main question seemed to be, was her death drug-related? When we did learn that her death was indeed connected to drugs and alcohol, people then struggled to understand why. Why would someone who from the outside seemed to have everything, certainly the resources to get help with her addiction, why would she continue to participate in a behavior that obviously damaged her talent, her family, and ultimately her life? Whitney joins an unfortunate long list of public figures who lost their battle with addiction, from Elvis Presley to Anna Nicole Smith to Michael Jackson. Many of us don't have to look to celebrities to see the devastating effects of addiction. We may see addiction in our neighborhood, in our families, in our homes. When we witness the downward spiral of an addict's life, whether it's from a distance or up close, we can't help but to wonder, why can't they just stop? Don't they see how much they're losing? We may judge them as weak or lazy. It just seems that if something is hurting you or your loved ones, you would find a way to stop. As we will discuss today, addiction is more than about willpower. Today's guest, Dr. Ellen Friedman, knows more than a thing or two about addiction, as she's been treating people struggling with addiction for over 30 years. Dr. Friedman is a clinical social worker, and she's currently the project supervisor for the Oasis Hotline at the Mental Health Association of New York City. Dr. Friedman also teaches at several local universities, including New York University and Fordham. She has an extensive history of managing addiction programs and treating clients in private practice. Welcome and glad to have you.
Oh, I'm really happy to be here with you, Anissa.
Yeah. So we started this discussion, framing it and talking about Whitney Houston, as many people seem to focus a bit, although she achieved lots in her life, they seem to focus a bit on her struggles, her very public struggles with drug use. Have you seen a response in terms of your work to people seeing what she's witnessed? People been coming in? Have people been talking about it?
Well, I think everybody's talking about it.
Yeah.
As they talked a lot about it after Michael Jackson died.
Mm-hmm.
We talk about it because it's so troubling to us, and it's so hard to understand.
Mm-hmm.
And the only way to understand it is to understand that addiction is an illness.
Yeah.
And that's very different than the way many of us have thought about it or families think about it. We wish it was willpower. And it's not.
Yeah.
It is a brain disorder. It is an illness, and that's a lot harder for people to accept.
Yeah. Can you tell me a little bit about your role at the MHA, the Mental Health Association of New York City?
I supervise what's the Oasis Hope Line, and that's a referral service for substance abuse and problem gambling in New York State. So it's a 24/7 Hope Line, and we can speak 140 languages.
Oh, wow. Yeah.
And we work with people to first find out that if they're safe, and if they are safe enough to wait, we give them referrals to different programs throughout New York State. And then we call them 2 business days later to see how that worked out or didn't work out. And if they still haven't gotten into treatment, we continue to call them a couple more times because we really want people to understand that they are supported and that treatment is available for them.
So would you say that there's a typical caller, that someone typically calls in for a certain reason, or?
Everybody calls.
Yeah.
A lot of people are family members who are concerned about a loved one's drug use or problem gambling. Many times it's people who have got DUIs and are looking for treatment and looking for assessments. And often it's people who say, I really want to get a handle on this. I'm tired, or I'm sad. And occasionally someone will call us who's drunk or high on drugs.
Yeah.
And the sensible part of them reaches out for help.
Yeah. Do you engage that part of them?
We do. And sometimes if someone's really in trouble, we'll call 911 to come get them.
Yeah.
but most of the time it's people who are looking for help or often family members.
Yeah, and I imagine when family members call, they're frustrated, they're concerned, they're worried. What type of support do you provide to them?
Well, we talk to them about getting into treatment, and a lot of programs can also work with family members.
Okay.
And then there are a whole bunch of 12-step programs for family members, like Al-Anon, places like that, or gamblers. There's a program for gamblers, families of gamblers.
Yeah.
So there's a lot of resources out there, and New York State is very rich in resources for people, and I really want people to know that.
Yeah, yeah. One of the things I wanted to focus on this show was this view that people have about addiction. As a mental health provider, as mental health providers, we oftentimes do our work, and we do our work with some type of driving understanding or perspective. Sometimes we call it theoretical orientation or your view of the problem. What's your view about why people struggle with addiction? What's addiction about?
Well, I accept the view of the American Society of Addiction Medicine because they came out very strongly this year and said it is a brain disorder, and that a lot of the things we find troublesome about people who are using drugs are actually consequences of that brain disorder. So it didn't start with somebody being willful or selfish or oblivious to the consequences of what they're doing, but when they get caught up in the cycle of substance abuse, including alcohol, it's not within their control. It is an illness, and I truly believe that. And when there are periods where people can abstain, Whitney Houston had periods where she did not use drugs or alcohol at all. She went into treatment, but it is also what we call a chronic illness.
Yes.
Which means there are going to be quiet periods, and then there are going to be difficult periods. And I accept that, and we need to accept that. People don't stop smoking often after one try. People go on diets for the rest of their life, so sometimes they're great, and sometimes they're more vulnerable. That only in addiction do we expect someone to stop and never turn back or never be vulnerable. When an asthmatic has an asthma attack, we don't blame them. We treat them. And I'm hoping that we move toward a time when we can be as benevolent and as fair-minded as we are with asthmatics or diabetics. Because it is an illness.
And I think, I'm glad you're underscoring that, because I think part of the struggle that we have with understanding and supporting people who are addicted is that we don't see it that way. We don't see it as an illness. We see all the losses. We see the person is losing weight. They're doing things to harm us, whether it be taking things from our home. So we definitely look at it as more of a personality issue. So I'm glad you're making that point that a lot of it is an illness. If we were to look at it as an illness, how do you think we might treat a person who's struggling with addiction differently?
Well, I think we would be kinder. I think we would be more encouraged within our own selves to believe there is hope and share that with people. I think we'd be more supportive. I think we would also be more trusting of the science of addiction treatment so that we would feel that treatment can help them even if it's a third or fourth time they're going. I'm very big on the idea that stigma really deters people from entering treatment. They're afraid to be known as an alcoholic. They're afraid, and science really supports that. So I think we have a responsibility to stay with those people and say these people have a problem. It's not that the person is the problem. I think that's where we get really confused because it's so emotional for all of us and so difficult for families.
Because you say this person is an addict, this person is an alcoholic, and we could go down the list. So you're right, not that the person has a problem, we label them as they are the problem.
And also some of the language, and this is just my thing. When somebody uses drugs, we say they're dirty. And when somebody is not using drugs, we say they're clean. So it's permeated the very language with which we speak about people who have addictive problems.
Dirty implying that they're using, and that language, that word itself, speaks deeper to the heart of the person that goes beyond the addiction. In looking at the recovery process, You made an excellent point that when people are going through recovery or they are in recovery, that relapse will happen.
It's expectable. With any chronic illness, relapse is expected.
Yeah.
It's not failure. It's not the wrong treatment. It's not the person's will. It's expected. So if someone, again, going back to asthmatics, has an asthma attack, it doesn't mean it's wrong. And many of us say that addiction is the only illness where if the person doesn't get better, you blame the patient.
Yeah.
And I've thought about that a lot. So if somebody if somebody's taking antibiotics and they don't get better, the doctor's not going to say, what kind of fool are you and what did you do wrong? They say, let's try another antibiotic. We have to start to do the same thing with people with addictive problems.
And you know, as you say that, I'm thinking of the language that we even use in treatment. So if I'm a person who's living with someone who's an addict, a term that I'm taught that to be aware of is being an enabler, right? So how does one sort of navigate this understanding the recovery process, supporting someone who is in recovery while not becoming that enabler?
Enabler is a strange word, and we all use it. And I've often thought what it really means is someone who loves someone poorly. Because mixed in with enabling is also a concern, a love for that person rendered poorly and often assisting that person in ways that really are not helpful. But it doesn't mean they don't care about that person. It doesn't mean that they don't have their best interest at heart.
Yeah.
So I think we have to be clear with people who have a problem that they have a problem. I think we have to say the same thing. I think families have to get support for themselves because it's very exhausting and very worrisome. And take care of their own wellness and the wellness of their children. And understand and have faith that recovery is possible and get help for themselves because they're really the pivotal person in someone else's recovery.
Yeah. And I think what I hear you saying is caring about someone, loving them, is different from not having boundaries. It's different from participating in, with knowledge, their drug use.
Well, loving someone is seeing them as they are.
Yeah. What do you mean when you say that?
I mean, not minimalizing what they're doing because you smoked marijuana 30 years ago doesn't mean that your children who are using marijuana are not at risk. I'm giving you that as an example. Okay, it's not the same. They are your children. Marijuana is different. And maybe you got through that and came out unscathed. But these are your teenage children, and they are developing their brains, and it's not a really good idea at
And they're
all.
different people, too.
And they're different people.
They're not you.
They're not you. And this is not the 60s.
One of the things that I've heard people comment as I've watched, I think like a lot of us watch the news coverage of Whitney Houston, and you hear the pundits and you read the blogs, and there seems to be this perspective that there are some people who are just resistant to treatment, and there are some people who are hard to treat. Is there any such thing as a hard to treat addict?